Dr. James. Hello, I'm Dr. James. Have you ever felt that awkwardness when things ended much sooner than you wanted in bed? That moment when your body gives up prematurely and everything finishes too quickly, before your partner was ready, before you even had a real chance to enjoy yourself. And worst of all, there's that uncomfortable silence afterward, both of you pretending everything is okay. Even worse is when it doesn't get hard at all, when anxiety is so overwhelming that your body simply locks up before things even begin. This isn't uncommon, and you're far from alone. A study published in the Journal of Sexual Medicine revealed that 1 in 4 men under the age of 40 has already experienced this. It's not just you. It's not all in your head, and there's nothing abnormal about it. It simply means you need a strategy, a technique, some practice. And that's exactly what I'm going to show you now. The truth is, millions of men suffer from this, yet nobody talks about it openly. But here's the good news. A solution exists, and you don't need any medications, blue pills, or miracle supplements. I'm Dr. James, a physician with over 35 years of experience specializing in men's sexual health. In this video, I'll show you 5 natural fundamentals that have already helped thousands of men last up to 40 minutes in bed. These methods are safe, practical, and 100% natural. If you want to regain control, impress your partner, and live a more confident, vibrant sex life, stay with me until the end. This could be the turning point you've been waiting for. Let's get started. Number 1. Kegel exercises for ejaculation control. If you've never heard of your pubicoccygeus, PC muscle, it's likely responsible for your inability to control the moment of pleasure. This muscle, part of your pelvic floor, acts as a sort of ejaculation switch. It's what activates the release phase of semen, and it can be trained to hold back the ejaculatory reflex at the critical moment. A study published in the British Journal of Urology showed that men with premature ejaculation who underwent a course of controlled pelvic floor training for 12 weeks were able to triple the duration of sexual intercourse without using medication. That's right, it's not a miracle, it's training. And you can start right now. How to perform them. Sit or lie down in a comfortable position. Imagine you need to stop the flow of urine midstream. That's the muscle you want to engage. Hold this tension for 5 seconds without holding your breath. Then relax for 5 seconds. Repeat this cycle 10 to 15 times, doing 3 sets a day. As you progress, try doing the exercises standing up or during your daily activities. It's discreet, it's free, and it works. If you do these exercises every day, your body will start to respond differently within a few weeks. You'll feel more control, more confidence, and most importantly, more time to truly enjoy yourself without a single drop of medication. And this is just the beginning. Number 2. Perineal compression. Few men know about this, but it's one of the oldest and most effective techniques to prevent premature ejaculation. It works by directly impacting the reflex that controls the expulsion phase of semen. During intercourse, there's a point of no return, a moment when the body takes over and ejaculation becomes automatic. Perineal compression acts precisely at this critical moment, intervening with muscular pressure and interrupting the ejaculatory reflex before it fully activates. According to a review published in Sexual Medicine Reviews, physical compression methods at the base of the penis or in the perineal area significantly reduce the incidence of premature ejaculation, especially when combined with mindful breathing and controlled pauses. The best part? This technique is easy to learn. It can be applied during masturbation or sexual intercourse, and you don't need any equipment or prior experience, just an awareness of your own limits. How to perform it. During sex or masturbation, when you feel your arousal level approaching that critical point of no return, where it feels unstoppable, Immediately stop stimulation. With your index finger or thumb, apply firm pressure to the base of the penis, right where the shaft meets the pubic bone. Alternatively, you can apply pressure to the perineum, the area between the scrotum and the anus. This zone contains muscle fibers directly involved in the ejaculatory reflex. The pressure should be firm but not painful, lasting for 4 to 6 seconds. If you wish, you can accompany this moment by holding your breath or fully concentrating on reducing arousal. Once you feel the sensation of imminent release subside, release the pressure and only continue stimulation if you truly feel ready to proceed with control. This technique can be used multiple times during a single sexual encounter. Your body learns through repetition, and you gain control, stamina, and time. It may seem simple, but applied correctly, this can be the difference between ejaculating in 2 minutes or confidently lasting until the very end. Number 3. The stop-start technique. The stop-start technique was created with a singular purpose: to teach a man to recognize when ejaculation is approaching and to interrupt stimulation before it happens. It's simple in theory, but incredibly effective in practice when done correctly. A study conducted at Ankara University and published in the International Journal of Impotence Research showed that men with premature ejaculation who consistently applied this technique for 6 to 8 weeks increased the duration of intercourse by up to 300%, even without any other treatment. This result has nothing to do with luck. It's about neuromuscular re-education and the control of the ejaculatory reflex developed through conscious repetition. How to perform it? During masturbation or intercourse, pay close attention to your arousal level. When you feel you are approaching the point of no return, the moment when ejaculation becomes inevitable, immediately cease all sexual stimulation. During sex, this means stopping all movement, penetration, and, if necessary, withdrawing your penis. For masturbation, completely stop touching and friction. Take a deep breath, hold still, focus on your breathing, and wait for 30 seconds to 1 minute until the feeling of impending orgasm subsides. Only then return to sexual stimulation calmly and with full awareness of your arousal level. Repeat this stop and start cycle 2 to 4 times during a session, especially in the initial training phases. This helps your brain and body learn to recognize the signals of impending orgasm earlier and to develop a new behavioral response pattern. This is training. And, like any training, it requires regularity. It's not about holding back by force, it's about re-educating a reflex, regaining control, and transforming sex into a process that you govern, rather than one that governs you. With time, what was once an automatic impulse becomes a conscious decision. Number 4. Breath control. This might seem too simple to work, but how you breathe completely changes how your body responds during sex. Premature ejaculation, in most cases, is not a physical problem. It's a physiological glitch that starts in the mind, spreads through the body, and ends in just a few seconds, much too soon. And do you know what the most overlooked trigger is? Breathing. When a man is nervous, anxious, or feels pressure to perform well, what happens? His breathing becomes shallow, rapid, and irregular. This type of breathing activates the sympathetic nervous system, responsible for releasing adrenaline, the main neurotransmitter that triggers ejaculation and suppresses erections. In other words, improper breathing during sex is one of the fastest paths to ejaculating too quickly. But when you slow your breathing, control the rhythm, and properly oxygenate your body, the parasympathetic system is activated, which is responsible for relaxation, stamina, and prolonged arousal. And this isn't just theory. A study from Massachusetts University, published in the Journal of Behavior Therapy and Experimental Psychiatry, examined men with premature ejaculation who practiced mindful breathing during sex. The result: Nearly 70% of them increase the duration of intercourse by more than 2 minutes, solely by controlling their breathing without any other therapy. The reason is clear. Breathing is the only mechanism by which we can consciously influence the autonomic nervous system, and that makes it your most powerful weapon against uncontrolled ejaculation. How to perform it. Before sex, spend 2 minutes practicing mindful breathing. Inhale through your nose for 4 seconds, holding your breath for a moment. Then slowly exhale through your mouth, also for 4 seconds. Repeat this cycle slowly and with full concentration. During sex, follow the same logic. Don't let your breath accelerate with the rhythm of movements. Instead, breathe in a controlled and deep manner, keeping your attention in the present moment. This helps reduce tension and minimizes the risk of premature release. If you feel orgasm approaching, pause movement and breathe even deeper for 2 to 3 cycles until the arousal level subsides. Practice this even outside of sex. 5 minutes a day of mindful breathing in silence, with your eyes closed, will help train your brain to maintain control even in moments of high intensity. It seems simple, but do not underestimate it. Proper breathing can be the difference between losing control in 3 minutes and continuing intercourse with confidence, stamina, and complete mastery over yourself. Number 5. Mindful masturbation. This is, without a doubt, the most controversial of all the points, but simultaneously, one of the most effective if applied with seriousness and intelligence. Many men treat masturbation as an automatic habit. They do it in a hurry, with guilt, often hidden, almost always with pornography. And what's the result? A cycle of accelerated, superficial, and uncontrolled arousal. The body learns to react too quickly. And what's worse? The brain begins to associate sexual pleasure with a mechanical and instantaneous pattern. Now, stop and think. If your body is accustomed to reaching orgasm in less than a minute during masturbation, why would it behave differently during actual sex? The truth is, you reproduce what you train for. And that's why masturbation can and should be used as a tool for sexual re-education, but it must be done correctly. A study published in the Journal of Sex Research showed that men who practiced masturbation without pornography, focusing on ejaculation control techniques, such as mindful pausing and slow breathing, demonstrated significant improvements in intercourse duration after just 6 weeks of regular practice. This happens because mindful masturbation allows you to train the same techniques that will be used during real sex, but in a safe environment without external pressure, with full focus on control and learning. How to perform it? Choose a time of day when you are alone, unhurried, and free from distractions. Eliminate any artificial stimuli. No pornography, videos, magazines, or forced fantasies. Keep your entire focus on the sensations of your own body. Begin masturbation slowly and mindfully. Observe every sensation. Breathe deeply. Do not rush. When you feel orgasm approaching, completely stop stimulation. Remove your hand, take a deep breath, and wait for the arousal to subside. At this moment, you can also apply other techniques, perineal compression, breath control, or simply focus on emotional slowing. Once the urge diminishes, return to stimulation with full control. Repeat this pause and return cycle 2 to 3 times before allowing yourself to ejaculate. In the end, only allow yourself to orgasm when you are confident that you controlled the process from beginning to end, rather than succumbing to an impulse. This type of training forms new neuromuscular connections. You learn to recognize your own limit, to slow down in time, and to maintain control even in real-life situations. Mindful masturbation is about independence, not weakness. It's a technique, it's self-knowledge, it's a tool for control. Use it responsibly, and in time, you will see a complete transformation of your sexual life. Dr. James. You've just learned about 5 of the most effective strategies to control ejaculation and prolong intercourse, without medication, without side effects, and with a real scientific basis. But all of this won't bring results if you just watch and don't apply anything. For even deeper insights and proven expert advice on men's sexual health and addressing challenges like premature ejaculation, subscribe to this channel. We are here to help you every step of the way. If this material was useful to you, please consider sharing it right now with other men who also deserve to regain control over their sexual lives. You could change someone's story with a simple click. Thank you for watching, and here's to a more confident and fulfilling you.